All right, well, we are here together today. I'm going to go ahead and get started because we have a lot of good content to get going. So we'll do a soft roll into this, and then I think we're going to have some more folks join us. Today, we are here as part of our Communicating About School Mental Health series. And so some of you may have participated in part one. We also offered a version of this back in March, but this is a new and improved version where we have a final graphic tool to share with you about the role of teachers in school mental health. And so we're going to go ahead and get started, but there are lots of resources to share today. I want to make sure that folks feel comfortable. If you have questions or concerns, you can always put them in the chat, and I have my team, Andrew and Sarah, with me today, and we'll help kind of navigate you towards the different pieces of information that we're providing today. Apologies for that interruption. Give me 1 second. Okay, that was my buddy Ramon. He's here today. I wanted to say good morning also. He's a very large Bernese Mountain Dog. And he is with me in California, not in the Southeast. The folks at the Southeast MHTTC, Mental Health Technology Transfer Center, have much more polite and well-behaved dogs, and also have lots of additional resources to share with all of you around school mental health, and then more broadly about mental health work. And I wanted to just make sure that you all knew that we are funded by the Substance Abuse and Mental Health Services Administration. And we are so grateful to them for being able to bring this to you in response to requests that we had from the 8 states that comprise the region that the Southeast MHTTC serves. And so I'm going to share a little bit more at the end about how you can stay in touch with us, but just know that today's resources, as well as a whole bunch of other resources, are available on their website. And so we can make sure that you access that by going to southeastmhttc.org. We do have some additional upcoming trainings to share with you all. But again, they have a broad range of resources that we want to make sure that you can access. And that's all because SAMHSA gives us the support that we need to bring these learning opportunities to you. So again, my name is Christina Borbet, and I work with the Emory University team where the Southeast MHTTC is located. I'm so excited to be here with you today. This is one of my favorite series to talk about because I'm passionate about I'm passionate about school mental health, and I'm passionate about bringing that passion to other folks. So one of the conundrums that we're in as champions of school mental health is that very often we are working with folks who don't have a mental health background. And so when we heard from you all in the Southeast that one of the capacities you wanted to build was the ability to communicate about school mental health, the value of it, the impact of it, our respective roles in it, it just was kind of a natural fit. And so what we put together is in this series kind of covers a range of content, but what we're drilling down to today is how we can use visual aids to teach, visual aids to communicate about this kind of really sometimes complex and especially if you don't have a mental health background, overwhelming concept of school mental health and how does that relate to me and the work that I'm doing with students. So we're going to talk a little bit about what's already out there in terms of graphic tools to support school mental health. We're going to talk about how the value of using visual illustrations to communicate ideas is particularly powerful for school mental health. And then I'm going to spend the bulk of our time together today introducing you to not only a new graphic tool, but a suite of tools that will support your use of this new graphic design. And so for those of you who maybe participated back in March, I just wanted to highlight for folks that we really made this a collaborative and participatory process. So we came up with a beta design. We presented that beta design in March to folks and welcomed input. And we got so much good feedback. And so today isn't a repeat of that session. Today is the launch of this suite of tools, really focused on helping you communicate about the teacher's role, right, an educator's role in school mental health, in student wellness. So that's what we'll be spending the bulk of time together today. And I'll be sharing lots of supporting resources for you to be able to implement and use this tool in your communities. So let's kick it off together. I wanted to just let folks know that a lot of this content or a lot of these concepts is coming from research that was done by the Frameworks Institute. And this is something that we presented in our Communications 101 series. We just shared that on July 22nd, and we also shared it last March. And so we are going to have the archived recording of that if you weren't able to participate. That'll be available on the Southeast MHTTC website. But you do not have had to participate in that to participate today. The point here is the Frameworks Institute did some really, really foundational research for us. Instead of kind of just wondering, like, what's going to work? How can we talk to people without a mental health background about school mental health, about children's mental health, and taking kind of a stab in the dark and just kind of guesswork at what's the messaging, what's the elevator pitch. The Frameworks Institute spent a few years working with a team at Harvard University to basically do the market research, to really look at what is it that the general public thinks about children's mental health, and how can we convey accurate information so that they understand what it is. And so one of the key findings is that the general public have a lot of contradictory ideas about what children's mental health is and isn't. They also have a lot of misinformation or misunderstanding about what children's mental health is. And so you can see in this graphic here that a lot of these ideas probably don't resonate with your understanding of what children's mental health looks like. And so how do we change minds? So changing minds, changing attitudes, changing beliefs is hard work, especially when it comes to some of these complex ideas like child development, mental health. And it's also can really kind of be difficult to shift depending on what sort of culture we're working in. And so when we think about how do we make change, the Frameworks Institute gives us some really concrete evidence-based strategies for how to convey important information about children's mental health. And in our Comms 101 session, we talked about this particular template for communicating about children's mental health in schools. We talked about how to identify shared values, so finding common denominators. We talked about clarifying the issue, so making sure that folks understood why children's mental health in schools matters. We simplified the model. And for folks who participated, you know, this is the trickiest, level 3 is the trickiest step for me, because I am so excited about children's wellness, about student wellness, about school mental health, that oftentimes I over-explain. And so level 3 gives us some really specific tools for how to simplify the model for folks who are not coming from a children's mental health background. And then the template also provides level 4, which is to offer specific and concrete solutions that engage all of our audience that we're trying to communicate to. So that's kind of an overview of what we covered in Communication 101, and really kind of sets the platform for today, right? How do we communicate about our shared values, what the issue is, what the model is, and then how do we make change? And so we'll be talking about that in the context of this new visual tool today. So why do we, you know, when we thought about, okay, what is the audience that we want to focus on communicating to? One of the key things that we heard from you all in our feedback session was that we know that we're engaging so frequently with teachers, with educators, with folks who are in the classroom. And they kind of run the gamut in terms of their understanding about children's mental health and about school mental health. And so our key objective in bringing this tool to you is to make sure that we have a platform, that we have a means to really make sure that teachers understand that they do have a role in children's mental health, whether they like it or not, and that they're not alone in that role, right? So I have found often that you have kind of, it's not entirely binary, but I find that there's a lot of people who fall into two camps. One is, hey, I'm a teacher, I educate kids on academics, and their mental health has nothing to do with the work that I do. The other camp are teachers who really take an active role in children's wellness and feel like they want to contribute to that young person thriving in their social emotional development as well as their academic development, and oftentimes feel like they're alone in that work, that they're isolated in that work. And that can really contribute to a sense of burnout, a sense of frustration. And so what we wanted to do was kind of pair those two camps together with a tool that would help connect everybody to the idea that, yes, we all have a role at school in supporting children's mental health, and we're not alone in that role. And so how do we convey that? The research that we have looked at shows very clearly that in all teaching, and those of you who work in schools probably know this from your own experiences, that visual learning, having visual aids, is a really effective strategy for conveying information. That's both true in adult learning in our K through higher education learning. Right? So how do we use visual tools effectively? It works really well when it's done well. And I wanted to spend just a little bit of time talking about, do we do this well? As a kind of a precursor to this, I love a good infographic. I don't know about you all, but I just love the infographic designs and how they convey information in really personable and accessible formats. And so I thought, hey, I want to make sure that folks have access to all of the different school mental health graphics because there's so many awesome ones out there. And what I want to show you is a compilation of some of the pieces that I found. And I'm going to warn you ahead of time. It violates all of the PowerPoint best practices by putting too much information on the screen at one time. And so before I show it to you, I just want to warn you, the idea is not for you to read all of this. Okay, so I'm going to show it to you. And this is like the high level point of, wow, we sure pack in a lot of content into our school mental health graphics. So we have a couple of examples here on the left side. So again, don't hurt yourself trying to read this teeny tiny font. I'm going to share all of these with you in a separate resource. So you don't need to look at it in the PowerPoint. But I wanted to just give you examples of school mental health graphics that focus on our places and our connections. On the right side here, you can see examples of our continuum of need and response. I want to share other examples with you of our levels and tiers of response. So the pyramid is a really common aspect of the school mental health graphic. My favorite and #1 winner of can you fit more information on the page is this right side graphic. I call it the everything school mental health pyramid of interventions. So this is pushing it in terms of falling into the category of an actual visual aid because it's mostly just text on the page. It's not including more of that graphic design component to break up the information into consumable pieces. It shows, so if we really look, if we drill down and look at this right side example, everything SMH, I feel like my point here is, imagine if you don't have a school mental health background, if you don't have a mental health background, if you don't have a child development background, and this is what you receive as like, let me explain it to you. You get lost immediately and you feel overwhelmed and you feel shut out from the information. And so what we're trying to do is move away from this type of experience. Now, all of these tools, I'm going to go back a slide, all of these tools have benefits, right? So they all are useful for different audiences, for different objectives. And so I want to make sure that you know there are so many good resources. And what we did to support you in using graphics and using them strategically to communicate about school mental health is we created a compendium of all of the existing school mental health graphics that we could find. And so we're we're going to share a little bit about that later today, but we basically have a resource page. If you haven't seen it already, Andrew's going to put it in, not right now, Andrew, because I want folks to stay focused on what I'm talking about. But we've collected probably about 15 to 20 different graphic examples, and we've annotated them for you. We've just kind of put in a description of what are they trying to communicate, who are they trying to communicate it to, and suggestions for the context in which you might use it. And so that school mental health graphic compendium is going to be available on today's resource page, and I'll share that link with you a little bit later, but I don't want you to get lost in the forest of graphics right now. What I want you to focus on, stick with me here, is a new graphic tool that we are presenting to you today on the role of teachers. And I want to pause here. We're going to spend a little bit of time talking about this tool, but I wanted to just make sure that you all who are joining today feel like you know what you're getting into. So I'm not teaching this tool today as if you are the teacher. So if you don't have a background in school mental health, this might feel a little bit removed for you, because what I'm doing is teaching you how to teach this tool. So the idea is that you might need to talk to principals, to superintendents. You might be participating in a kickoff meeting for staff at the beginning of this school year. You might have a team that you're working with a multidisciplinary team or student support team where you really want to drill down on what's the role of teachers. And so what we're presenting today to you is a tool and how to use this tool, which is a little bit different than if I was actually implementing the tool directly with a group of educators, with a group of teachers. And so I just wanted to make that clarification. If it feels a little bit awkward to you, that might be because you wish that I was teaching you the actual content in the tool instead of how to use it. And if that's of interest to you, you can just flag that in the chat and we can think about how we can bring that actual content to you. But right now, this is kind of like a, hey, you are the school mental health Smith in your community. I'm sharing a new tool for you to put in your tool belt and talking to you about how you can use that tool as you're building understanding, awareness, and buy-in in terms of teachers' role in school mental health. So hopefully that's clear. I just want to pause for a second and see, Sarah, Andrew, are there any questions or clarifications that have been requested in the chat before I move forward? Okay, thanks, Sarah. All right, so as I mentioned, we have an entire compendium of school mental health graphics. So why am I bringing you one more graphic? Again, what we heard from you all is that you needed a way to communicate to teachers about the role that they have in the sense of instilling a sense of awareness and responsibility for how they impact student mental health. And for those teachers who are deeply engaged in school mental health with their students in their classrooms, that we wanted to have a way to communicate to them that they are part of a network, that they're part of a constellation of adults on campus who are supporting this work. Again, so that they feel an allyship with their colleagues, so that they feel inspired to coordinate, to collaborate, to partner in their efforts. And so we wanted to design a tool that would serve both purposes, like, hey, guess what, you're in it, and hey, guess what, you're not in it alone. And so that was the main objective of this particular graphic. And then as we were designing it and creating the graphic, I realized, hey, we can't just like hand off this beautiful tool with all of these images without having this suite of resources so that you all can support it. And so what we're going to talk about today is how to use this tool in terms of accessing the toolkit, and then we'll go through together and review the tool itself. And so before we get into reviewing the tool, and I'm going to say this now, then we're going to review the tool, and then I'm going to say it again. So right now it might feel a little out of context because you haven't seen the tool or the finished tool yet. And you'll be like, why are you talking about this? But I'm going to say it now, I'm going to share the tool, and then I'm going to say it again. So let's take a look at what's in your resource toolkit. And Andrew, if you want to go ahead, actually, I think this would be a good time to put the link to the landing page in the chat. So Andrew created this beautiful resource landing page that contains all of this content. So the very first two things I want you to focus in on are the tool itself. And we have a long form version and we have a short form version. Today, we're going to go through the long form version, and it's 14 images that really illustrate the teacher's role across all three tiers of support and the connection of allies on campus to the work that's happening in the classroom. And we look at that in the classroom, we look at that in the counselor's office, and we look at that on campus. So the long form, again, it's 14 images that we'll go through just shortly. And they're all beautiful and amazing. And also you're gonna say, Christina, hey, I don't have enough time to go through all of this content. I need you to sum it up for me in a one-pager. And so that's our short form version. And we'll talk about how to use that effectively in conjunction with the long form. The other pieces that you'll have in the toolkit so we have this available to you as a PDF. All of the images are in a PDF file, the long form and the short form. I also translated them into a very basic PowerPoint template for you. And so that allows you to just kind of like grab and go if you are doing some sort of visual presentation, either online or in real life, where you can take those images and integrate them into any presentation that you might be given. And then the other piece that you'll have in your toolkit is a style guide. So we did work very closely with a graphic designer. I am not the artist behind these amazing images that you're going to see. And our graphic designer created a style guide, which was really educational for me since I don't have a graphic design background. And so if you're thinking about uses of it, adaptations of it, the style guide really provides you with the nuts and bolts for the color formulas and the layout on the page and that sort of thing. And so in addition, so these are all available to you today. The landing page that Andrew shared also has that, that school mental health graphic compendium that I talked to you about earlier. And then in a little while after today, we'll also upload a recording of today's session. So if you want to go back and review any parts that I talked about today, you'll have that available. So that's kind of the overview of the toolkit. I'll remind you about this again after we review the tool. But let's talk a minute about how you might want to integrate this tool. So what is the intention? How does it work? So as I mentioned, the long form is 14 different images. These are the kinds of images that you can use as a standalone resource. If you're creating some sort of white paper, if you want to put it in a newsletter, if you want to send it in an email. As I mentioned, they also are well suited to be a visual aid in presentations that you might be given to different audiences. And then for those of you who have a little bit more media savvy, you can animate this. So just a really simple way of doing that would be to use PowerPoint, which has like a recording tool that allows you to actually record a mini video where you can add your own talking points and voiceover. And if that's something that you want to share, you can as well. There's also options for formatting this into social media. If you want to do a social media campaign, if you want to share this via Twitter, via Instagram, depending on what types of information dissemination platforms you're using in your community. So that's kind of these, and again, it's not limited. And so as we roll this out and as we support you in rolling this out, we'll be really curious to hear about how you use it and where it fits into your communication plan. So this is we're almost to the actual graphic. And so I wanted to just share a couple pieces that I'll be talking you through. So again, you're consuming the information, I'm showing it to you, I'm teaching you how you might be able to implement or use this in your community, right? With your community of teachers and educators and other stakeholders on campus. And so I want to highlight for you what's happening in each of the images. And so first I'll be going through the visual orientation to the information. So placement of the content on the page, how we selected the text that we shared so that it didn't look like that everything SMH graphic, right? So that we have a consumable text narrative to present. And then how we used visual cues, icons, and color to orient the consumer, to orient the viewer to the page. The other piece that we're going to reflect on a little bit, you'll have more time obviously to process this on your own, is the appropriateness and the relevancy of the examples. And then I also just wanted to share some of the organization of the information. So for example, in the graphic tool that we created, we were trying to balance a tool that would work for folks who are doing multi-tiered systems of support, or PBIS. So you'll see a nod to colors and a nod to shapes that orient towards that tiered system of support. But we also recognize that there's a lot of communities that are not using that particular framework to organize their school mental health. And so we also created a tool that can be adapted to a wide range of frameworks or systems that folks might be using in their school mental health in their communities. The other key piece that I wanted to highlight is the examples that we use, and we wanted to make sure that we are honoring different cultural practices, different levels of resourcing. So all of the examples that we use in this tool run the gamut from a low intensity resource to a high intensity resource. And we wanted to make it sure that it was really clear that this is a snapshot. This is not the be all end all of school mental health, because we could only fit so much on the page, right? So we had to be really judicious in what examples that we selected so that we could kind of cover the gamut for the whole region. But we do understand that some of you might want to adapt the content. And so again, I want to emphasize two things. One is that there was a lot of thought and expertise from our graphic designer and our team to select the content that we use to populate this image, and wanting to create something that was both meaningful and generic enough for all of you in all of these different communities in the Southeast to adopt. And we also recognize that you're going to look at it and be like, that doesn't work for me, Christina. We use a different word, or we have different spaces on our school campus that we'd want to represent. And so I just want to encourage you to be really strategic about adaptations that you make. And I also want to encourage you to refer to the style guide, right? So that design guide has some really key pointers for if you're making changes. And as we're looking at this, you're going to see it and you're going to be like, nope, that's wrong. Like that won't mean anything to the people I want to communicate with. The easiest thing to adapt in this tool are the actual words, right? So the actual text. And so subbing in the terms that make the most sense to the folks that you're communicating with is the easiest adaptation to make. And so I just wanted to highlight that for you. Because it's in PDF, if you have Adobe Pro, you can just click on edit the document and edit those words. And all of the kind of font specifications are available in that style guide. So I'm going to pause there. And I'm just giving everybody an opportunity to get ready, because we're going to go ahead and look at the resource, look at this tool together. And I wanted to encourage you to take a moment to get situated, and you have a few choices. So Andrew, if you could upload the PDF, that would be great. And if you want to put the link that goes specifically to the long form in the chat, that would be great. And so for folks, as you're viewing this, I know sometimes looking at it through the PowerPoint can be really disorienting. And so you can follow along with me as I'm sharing this with you on Zoom, or you could minimize the screen and listen to me, and you could either look at it online, because Andrew's putting the specific link to this long form that we're going to review together. He's putting that in the chat, so you can just click on that and look at it in your browser. Or you could also download the PDF file right now. So Andrew's going to upload that for you. In all three places, it's the same thing. But I recognize how you are able to consume it on your screen varies person to person. And so I want it to feel comfortable to you. So I'm just pausing here so everybody can get set up. Hopefully you're looking at this cover page of our new tool. and you can decide which viewing option is going to help you connect the most to this material that we're going to go through together right now. Okay, so as you're getting set up, we're starting here on the cover page, and we're going to go through the 14 images together, where I'm just kind of giving you, again, I'm not teaching it to you, I'm teaching you how to teach it or how to integrate it into your communication plan. So I'll just be kind of giving you the overview of why we made certain choices. And I want to encourage folks, if you have questions, to go ahead and put them in the chat. I want to get, I want to make sure that we're answering your questions and integrating your ideas and recommendations. So what we have here, again, is our cover page. This is the most color intensive page in terms of the range of colors if you're thinking about printing this out. And I wanted to just highlight for folks that we loosely wanted to represent in our photographs what might be happening at each of the tiers, right? So at tier 1, we're thinking about school mental health for everybody, right? So that's our green tab, and this green, gold, and raspberry colors are nods to the PBIS pyramid, which use a traditional stoplight, green, yellow, and red. We did make some modifications here in terms of the color and the tone of these so that they felt more friendly. I was working with a few folks who felt like I don't want to be the parent of a child who's in the stoplight red colored zone. Like that doesn't feel like I want that for my kid. And so we did make some adjustments in the tone here. And again, if you're using an MTSS or a PBIS framework for school mental health, it should visually cue folks to be like, oh, I'm in tier 1, it's green, without necessarily alarming folks who are not using that system or find that to be a visual stimulation that is unfriendly. You can see our imagery here is inclusive, that in tier 2 and tier 3, our images include adults on campus. So sometimes it's implied it's a teacher, other times it could be just another, more vague or ambiguous role of an adult on campus. But you can see in tier 2, we have a smaller group, right, for more intensive supports and services in school mental health. And then in tier 3, we're showing a one-on-one interaction to indicate that this might be the higher intensity level of school mental health support. The other thing I wanted to just acknowledge in this tool that we designed is that we wanted this to be applicable for elementary school through high school. As you potentially customize this for your own community, you may feel the need to represent a specific age group. And so swapping in imagery to represent that is an option. I'm going to go ahead and move us forward. So again, this is just our introduction page. And what we're showing here is that we're giving examples at school where teachers and school staff support school mental health. And the 3 places that we're offering these examples are examples in the classroom, examples in the student services room, and examples in campus spaces. And so again, some of these visual cues like the icons are going to repeat throughout the document. So for folks who, we have a lot of learners who are very visually oriented, and so seeing the icons repeated will help anchor them in what space are we talking about. I wanted to just highlight for folks that the middle space, the student services room, that was one of those wording choices. The wordsmithing for this particular space was a tough one, right? Because we wanted to use wellness room, we wanted to use counselor's office, we wanted, there are a whole range of places that could embody a designated place on campus where there may be wellness resources. And so this could be one of those areas that you feel that you need to customize to reflect what you call it on your campus. But student services room seemed to be the most encompassing. The other thing I will say is that you could anchor this in reality-based, so your real life-based terms. or in aspirational language, right? So I liked the term wellness room, but the feedback we got was, we don't have a wellness room. We don't even have a room. And so, thinking about strategically changing it to be optimistic, like, we need a wellness room, so I'm going to call it a wellness room, or to be grounded in what folks, whether it's your, your county office of education, your superintendents, your educators themselves, so that they recognize and feel a link, a connection to this content and say, like, oh, I know where that place is on campus. I could actually go there. So moving us forward, I just wanted to highlight, so now we're dropping in, we're going to go through for classroom, for student services room, and campus. We're going to go through the 3 tiers of the spectrum of support, tier 1, tier 2, and tier 3. So looking at the first 3 graphics for classroom, we have school mental health for all students, for some students, and for a few students. Some folks in our feedback forum felt like this was a filler slide and they just wanted to jump in. And so you may decide to take out this particular image if it feels like it's too much, or you need to pare things down. For others, you may want to help walk folks through, like, step by step. So here we are in the big picture. Now we're going to knock on the classroom door and show up here. What are we going to find in the classroom? Well, the first thing we're going to look at is our examples of school mental health for all students. So again, there's a lot of text on the page here. Before you drop down into reading it, I want to just give you some high-level points. One is that a very important discernment to make as you're presenting this information is that all of these are just examples. So we want to make sure that we're really careful not to imply that these are the required things that teachers have to be doing, or that these are the only answers or solutions to providing school mental health for all students. These are only examples, and we could only fit 3 in here, right? So again, we had to make really tough choices. You might want to substitute in examples that make more sense for your community. If you're going to think about doing that, I want to highlight that you are limiting it. Keep it to just a few examples on the page. And then also, if possible, if you feel like it suits your culture, give a range of examples. So if we look here at the green box with the white font, you can see our very first example greets each student by name. That is an example of our low intensity resource, right? So it doesn't cost money. Anybody can do it, doesn't require training. You don't need any particular credentials to greet somebody by name. And then if we drop down to the third example here, implement evidence-informed SEL practice or curriculum. So that's one example of a higher resource intensity practice. So I just wanted to highlight for folks that this is the opportunity to show teachers who are in their classroom that they're not alone, even though they might be, and some of them might feel just like stuck in there all by themselves, that there are other folks on campus who are supporting the work that they're doing. And so we selected these 3 allies. These allies could differ depending on your community, but we selected the school counselor, the principal, and school resource officer, just as examples. And what we did was we tried to connect something that those 3 allies would do for the students in the classroom. So how are they showing up in a way that's enforcing, reinforcing, complementing the work that a teacher might be doing in their classroom? And it creates this sense of, I'm not in it alone. I have other people out there who are watching out for this kid, or for these kids, or for all of us. And so again, the same things apply if you want to make modifications here. Keep the examples really brief, and try and give a range of examples, emphasizing that they are examples. The last thing I'm going to say before I move us forward is that the icons on this page were selected really strategically. Again, I'm not a graphic designer, so going through this process was education in and of itself for me, but being really thoughtful and intentional. And if you are interested in swapping any of these out, our graphic designer in the design guide gives specific recommendations for how to select icons and how to place them on the page so that they're going to create They're going to draw interest in without overwhelming the viewer. Okay, I'm going to move us forward. So that sets us up for what we're going to see on the next few slides. So again, we're still in the classroom setting. We're still with predominantly the teacher. But here we move into tier 2. So this is going to be more intensive or targeted level of school mental health resources. And this is structured in the same way. So as we're presenting this to our audience, as we're communicating to our audience, it should start to feel familiar. And again, we use the same structure, a range of resource intensity in our examples. We're repeating the same allies that we mentioned before. So from an adult learning perspective, we didn't want to offer examples of 3 different allies as we did in our universal tier. We want to just keep showing, like, how do school counselors show up at tier 1, at tier 2, at tier 3? How do they show up for all kids, some kids, for those few kids who need more intensive resources? So again, the same thing applies. You can see our backdrop, our icons are the same when we stay in the classroom, right? So again, we're not asking the brain, the learner's brain, to take in and process new information. We're like, okay, I'm in the classroom. I see that image of the body in front of the whiteboard or the chalkboard. I see the schoolhouse image. I see the microscope. So all of these things are saying, like, I'm still inside my classroom space as I'm learning about what do I do and what are my allies doing with me around school mental health. I'm going to drop us into our tier 3 or our more intensive level of support. And again, the same piece here and the same recommendations. You can see that we're using our raspberry colored instead of our stoplight colored red. And this tested well with our parents and the rest of our team who wanted to look at this from a more trauma-informed perspective. And this color felt friendlier and like a nice place to be in terms of getting access to resources and supports. And then again, kind of playing out the different examples that might happen at this tier. And so before I move out of the classroom and into our next space, I just wanted to pause and see if folks had any questions about the structure or specifically about the elements that we introduced in the classroom setting. All right, guys, you're sticking with me. So I'm going to move. So now we're moving out of the classroom space, and this is our intro slide. So again, if you need to shorten this, this would be an option for paring down and saying, okay, we don't need an intro to say, like, now we're in the student services room or the wellness room or the counselor's room, whatever you want to call it. But it sets up the same welcome. We're now in a different space. And we're going to shift some of our images, right? So you can see in the top right corner, we still have our icon of a schoolhouse to let us know we're still talking about school mental health. But our images on the left side of the page are kind of shifting away from that classroom setting and going to convey or visually anchor someone to the student services room. And so now we're going to go through the same setup. There are a couple notable differences. So we've moved out of the classroom and we're looking at examples of what is the mental health specialist or counselor doing in the student services room. So this doesn't have that pop-out box of school mental health allies, right? So I'm going to drop back so you can see the bottom right corner. These are our teachers' allies in class. When we move out of the classroom space, we're letting the teacher know who else is on campus and where are they, what are they doing? So that, again, they're feeling a sense of awareness and a sense of connectedness to the allyship in school mental health on campus. So the next two places, the student services room and the campus spaces, are more simplified visual presentations. The other piece that I wanted to highlight on this particular in this particular space, the student services room, not only did we spend a lot of time selecting the language for student services room, but also what to call the person we wanted to reference in this room. And so this one was the trickiest one. We came up with the mental health specialist / counselors space, right? So this is universal resources. You can see on the next one, we abbreviate, we create more acronyms, MH specialists/counselors. So this would be an example where you might want to drop in the language that you use. So this could be the student support, the student service specialist, whatever is the term that you use in your school, in your district, that you want to drop in here. And so we tried to make it as generic as possible so you all would recognize it and then be like, oh, I know what she's talking about, and drop your person in there. But some of the same structures apply in these examples. They're just examples, they're not requirements, and we're not limited to just these solutions for serving all students. These examples also do that same thing as they run the gamut of resource intensity so that we can honor that different schools are in different levels of readiness and have different levels of resources to implement supports for students. So I'm gonna go ahead and click us forward. This is our student services room for some students. If you're using a tiered system of support, it might be referenced as tier 2. I probably should have mentioned earlier that if you're not using a tiered systems of support, or that's not something that you feel like educators, teachers are going to recognize, that's one of the images that you could drop out of here, right? So you could still use the color coding system, and our middle banner there, right? Instead of saying tier 2, it says some students, indicating that there's a smaller group of students that might need these more intensive levels of support. So if this tiered system doesn't resonate with your community, this is something that you could modify. And then I'm going to move us forward to our tier 3, or to the few students who might need more intensive supports. And so again, I know for a lot of our schools, this tier 3, or this intensive level of resources, can be the trickiest one. If your school mental health continuum, the supports and services that you offer across the range of students' needs, is still in development, right? Or it's fluctuating, and you're like, I don't know what programs and supports we're going to have. And so again, encouraging you to think about using this either as a document that conveys what is available, or a document that makes the case for what could be available or what needs to be available to optimally support students. So again, this tool itself is designed for a lot of flexibility to communicate either what is or what you would like to make a case for. Okay, I'm going to drop us into our next space, which is campus spaces. So again, this is kind of thinking more globally and helping teachers and other folks on campus recognize what and why we're designing campus spaces for student wellness. Follows some of those same platforms, but again, we don't necessarily have a particular person attached here, right? Because if we look at these examples, for example, the first example, displays, the displays on campus celebrate cultural diversity and cultural identity. The clubs and programs offer extracurricular activities. So this could be fielded by any number of adults on campus. And so if you have a different way that you want to organize this, or a particular person that you want to reference in here, you can adapt this language. But we kept our campus spaces visuals more generic. Just again, sometimes folks who aren't looking at the 30,000-foot view, who don't have that school mental health background, might not recognize the value or the role that some of these resources and supports have for student wellness. So moving us forward, unless there's questions, looking at what we can offer in the campus spaces for more targeted resources around wellness. So peer mentoring program, student-led mental health awareness clubs, childcare center on campus for parenting teens. So again, all of this is part of the overall amalgam, the overall constellation of opportunities, of resources, of supports on campus. Even if it doesn't fall under your particular funding stream, all of these pieces can come into play to create a climate, to create an environment that supports student well-being. And some of these might not be right for your campus. And so we encourage you to campus spaces campus spaces that are for more intensive resources. So I want to just pause there. So this again, we've now covered. I'm going to leave this on here for a second. So we've now have covered these three. Hold on, let me go back to this overview slide. So we have covered in the classroom, the continuum of needs from all students to some students to some more intensive supports for a few students that the teacher can support adults who are providing input, providing resources in the classroom. So as you can see, as you're presenting this tool, you may just want to focus on one of these, or you may want to break it into modules. So the classroom and the teacher role is most tools that you're just focusing on, like, hey teachers, let me tell you what it looks like in your space where you're spending your day. And then you may want to gradually build readiness to extrapolating, right? To showing, well, while you're in your classroom, here's what's happening in other places on campus. And these are our more succinct or more simplified visual graphics of what's happening in a counselor's office or student services room, and then more broadly in our campus space. And so I want to just take a moment here to remind you, as I said, I told you before, I'm going to remind you again, this graphic tool and how you may want to implement it is supported by this suite of resources in our toolkit. So Andrew uploaded that to the chat. It's an online landing page that provides you with the long form. That's the 14 images I just showed you. We also have a short form, or the one pager. I want to encourage you not to just default to that one pager. It's a really nice snapshot, but it loses some of the depth. It loses some of the nuance that teachers and other educators might need to see kind of where they fit in the big picture, how all the pieces connect. But if you present a piece, the long form, and then want to give them that snapshot as a reminder, if it's something that you want to turn into a poster, to print out as a handout, we wanted to make sure that you had that abbreviated view. The same thing, in the toolkit, we're offering you that PowerPoint template. It's really basic. So it doesn't have your talking points in there yet. It doesn't have, you can kind of customize it for whatever type of presentation, but it does give you the flexibility to expand or contract the visual content. And then you also have that design guide. So Tamar Kandi, who's our graphic artist, put together this beautiful design guide to help those of you who like to get into the weeds with making changes and making adaptations. So her key recommendations and guidance are available in that style guide. And then again, kind of separate from our new tool, we just more broadly wanted to give you this resource of other school mental health graphics. So that's our school mental health compendium of some of those images. I showed you 4 images today. I think there's about 15 in there that you could also integrate into some of these presentations, some of these strategic communications that you might be offering. And so I want to just pause there and check in with all of you about how you think you might be using this content. And so I'm going to stop my screen share for just a moment and check in with all of you and see kind of ideas that come to mind for you about how this could be integrated. And not only does that help our team at Emory University, but I think it'll help your peers as well to start thinking about what are the practical applications of this. What do you see as the opportunities? And then what do you see as the preparation you need to do to make it useful for your community? Anybody want to unmute and share or put it in the chat? I'm hoping that the silence means that all of you are deep in the weeds of looking at our amazing resource landing page and some of that content that's in there. I see that we have Susan sharing that that not only is she going to use it with her teachers, but also going to be sharing it with community members, for example, in the Rotary Club. Again, I think this is the kind of thing that really builds awareness and understanding, and shifts norms and attitudes in the general public. And so, Susan, I'm not sure if you participated in our Communication 101 session, but I would encourage you to go ahead and take a look at the recording for some really kind of concrete and key ways to message school mental health, and then kind of use that as the context for sharing this new graphic tool. So I see Jill's going to share this with her school-wide positive behavior support committee, that we have other folks who are talking about using this as a way to enhance as a mental health provider, as a way to enhance their communications with their partners in school districts and on school campuses. So since I'm getting, I see, now people are chiming in, I see. I'm going to go ahead and share screen again, because there's a couple other pieces I just wanted to make sure that you get a glimpse at. So in addition to, as I mentioned, that 14-page, oops, that's not what I want. Here we go. That 14-page long form, I also just wanted to spend a minute to share the short form with you. So let me make this a little bit bigger. And again, this is in your resource toolkit. So this is what we designed as the one-pager. So again, visually, it's consistent. It kind of maps on to what you saw in the long form. What we're missing here, so just in case you're too tempted and being like, cool, shortcut, I'm just going to share the one-pager. I wanted to just highlight what we're missing here are the range of examples, right? So we didn't want to make that fatal flaw of just throwing all of the text from our long form into a teeny tiny font in a condensed short form. So what we're missing here are the nuance of the different types of examples, and then the range of examples in terms of resource intensity, in terms of maybe readiness on campus to implement different practices. But it does kind of drill down into a few things. Making sure folks know that school mental health is happening in different spaces on campus, making sure that folks understand that there are different people on campus who are all part of the support network for school mental health. And then you can see, I just want to draw your attention to the top row, the classroom row, where we really focus in on teachers. And in this again, similar to our long form, has more information than the other two rows. So in this section, we weren't able to provide all three allies, because again, you have to be judicious in our infographics in terms of how much text is contained. But you can see across the board, we start with our school resource officer as an ally, we move into our school counselor as an ally, and then we move into our principal as an ally. So again, snapshot view loses some of that nuance. And I feel like it could potentially be a disservice if we oversimplify and just rely on this tool. But this can be a really helpful grounding reminder. It can also be a visual supplement that you're putting up in a staff room, or sharing as a handout, or using as a quick reference guide as a booster a couple months after you introduce the long form content. So I wanted to just make sure that you all got a chance to look at that. And so, yes, so I see Beth saying like, this is a good thing to hand out after the presentation. I agree. I do just want to be sensitive, and in case you were deep into consuming the visual content, I'll flag for you again and just remind you that the actual, whether you're using a PowerPoint or whether you're using the long form PDF version, I just wanted to highlight that you can do this in modules. So it'd be really easy to break up by space and just do the portion on what's happening in the classroom, or to think about it by person and think about presenting each component by the person responsible. So whether you have a counselor or a student services director, or whether you're just doing teachers, and thinking about doing it in partnership with that person. So who can you reach out to and say, will you co-present this with me? So what teacher could be an ally as you're speaking to a group of teachers to say, what does this look like? What's easy or hard about this in your classroom? What do you need more of? What do you want to continue? Or what's missing, right? So making it conversational instead of just didactic. And so again, the same thing, reaching out to principals to talk about what does their allyship look like to school counselors or student services staff. What does it look like to teachers? How are they designing policies or systems that are informing campus spaces for student wellness? So again, building in the voice of these different stakeholders can help build our overall awareness, our overall knowledge, and then our overall practices around school mental health. So I'm going to pause there and just check in with folks and see at one of the key. So I want any feedback that you all have about this particular resource. So again, designed really specifically to help teachers on campus understand that they have a role in school mental health and that they're not alone in that role supporting student wellness and school mental health. So really interested in feedback on that. And then after I get some input from you all, I want to open it up to see, are there other audiences that you'd be interested in communicating with? And I have a hunch based on what we've heard in the past that there are some other folks that you're like, this is great for teachers, but I need it for ... But let's not jump into that. Let's just talk about what we have in hand right now. Any thoughts or recommendations for how we could make improvements to make this more valuable, have greater utility in the communities that you're serving?
Hi, this is Leah Colburn, and I had a thought as I was looking at this. You know, we're talking about school mental health allies in the classroom, which I love that. But I think something that's missing is the engagement of parents. You know, parents are also an ally. And so I think that's just an initial gap that I see with this. But I really love this overall.
Great. Thanks, Leah. Yeah, I think the parent engagement, caregiver engagement is a big piece. And when we had to make the choice of like who we were creating this tool for, that was one of the top contenders. But we did have to make a choice. We are looking ahead to the future. You know, in a few minutes, I'm going to be pinging you and asking you the favor of completing a survey that SAMHSA asks us to have you complete so that we can continue to offer these services. And this is a prime example, right? Making the case to SAMHSA for why we need to continue to do the work. Well, we need to do the parent version. We need to do the caregiver version of this graphic. So we're not quite there yet, but it's coming. I'm going to ask you for that. But I hear you. Thinking about how do we communicate to our parents and caregivers about their role, not only in their child's mental health, but how are they partners in the school mental health endeavors that are happening, that you're coordinating, that you're engaging in. And so thinking about how do we present that in a visual aid, again, you know, we can assume that most of our parents don't have a background in children's mental health. And so thinking about how do we create information that's accessible, that's meaningful, and that helps them feel engaged in what's happening at school. Any other ideas or recommendations for this particular tool? Okay, I'm going to take silence as a ringing endorsement that we've got it right. I love that. And I will let you know, as you're using it, it would be, you know, I very much welcome any examples of successes. That helps us, but also examples of things that maybe didn't go the way you wanted it to go, or things that were missing or felt like a flop the first time around, so that we can continue to refine this landing page with additional resources, additional recommendations. Again, we want all of you to be able to learn from each other's implementation and for us to be able to capture that and infuse it into our future products. And we are in the process of kind of planning out what the ongoing scope of supports looks like in this general concept of communicating about school mental health, and particularly communicating about school mental health to folks who don't have a professional background in mental health or school mental health. So your input is welcome. But as I indicated before, all of these opportunities we get to bring to you complements of federal funding from the Substance Abuse and Mental Health Services Administration. And what they ask us for in return is evidence that this has value, that folks participate, that folks attend. And so there's a really very brief survey that we ask you to complete. And Andrew, if you want to go ahead and drop that in the chat, that would be helpful. We are going to leave some time at the end of today's session. We do have some more time together for folks who want to stick around and do a deep dive, ask questions, brainstorm, start doing your prep and planning for how to integrate this. And I'm asking you to hold some of the time that we're giving back to you today to complete this survey. So again, it makes the case to SAMHSA that continuing the funding is warranted because you all are, again, engaged in this learning opportunity and finding value in it. So in addition, so that survey is the GPRA survey. Some people call it the GPRA survey. And Andrew has put the link in the chat. It's, again, very brief. If you could complete that, it helps us continue to bring these opportunities to you and develop these resources for you moving forward. And then there'll also be an opportunity if you want to offer specific feedback to Emory University about this session, that there is a separate link for another short survey where you can offer input on what worked, what didn't work, what you want to see more of, what you never want to see again. You just keep us posted. And so Emory's really receptive to getting your feedback, and we integrate that moving forward to improve opportunities, the offerings that we make to the field. But it's that SAMHSA GPRA survey, that GPRA survey, that allows us to bring these no-cost trainings to you all, that allows us to develop these types of resources and put them in the public domain for you to use and adapt. So really, really grateful if you can spend 2 minutes to fill that out. But what I want to do now, for those of you who want 20 minutes back in your day, you have some found time. For those of you who want to stick around and do a more interactive session on questions you have for what next, what steps do you want to take next, we're going to shift to that in a few minutes. I'm going to go ahead and share my screen again so that we can just do our concluding slides. So your next steps, make sure that you spend some time reviewing that. Oops, let me put us in presenting mode. Want to make sure that you spend a few minutes looking at that resource toolkit that Andrew posted the link to. Again, if you didn't find it in the chat, you can find it at the Southeast MHTTC website. And think about and plan for integrating this into your staff meetings, your leadership meetings, your professional development opportunities. Think about online tools and social media platforms where you might want to share this imagery in a series to, again, raise awareness and shift attitudes for how we practice school mental health, especially in terms of the roles of teachers. And we have up here for you all to look at an opportunity to stay connected. So we have additional trainings available. And Andrew, I know we're going to go back to the GPRA link, but if you wanted to put the link to register for our August 11th session in the chat, I wanted to let folks know that in addition to our communication series, we've been doing a wellness for educators, creating cultures of care series, and we have our third of 3 coming up on August 11th. So you can find that information either in the chat or by going to any of these links. We'll be talking about systems level change. So we have 2 different, we had part 1 and part 2 that were really about science-based self-care strategies for educators, looking at what's the evidence from the science, from our culture about what works for taking care of educators, especially during times of acute or chronic stress. We're going to be on August 11th doing a deep dive into how do we at the district level, at the school level, create a system that supports collective care for our staff, specifically for our staff. So parts 1 and part 2 really focus on the you, like what can you do for you and your wellness right now? How can you be part of your individual self-care plan and a collective self-care plan for colleagues? And then in part 3 on August 11th, we encourage you to register if you consider yourself a leader, if you consider yourself a champion of a culture of care for all staff in your schools and in your district. So Andrew put that link in the chat. You can find them here, but I'm gonna, before folks start dropping off, I again wanna encourage you to go ahead and let SAMHSA know that you were here today by clicking on this link that Andrew is putting in the chat to complete the GPRA survey. So again, deep appreciation for all of you in the Southeast who were collaborators in creating this new graphic tool. So we got so much good feedback, and I feel really proud that we were able to create something that represented the different points of view and the different needs and opportunities to support you in your community in communicating to teachers about their role in school mental health. So thank you. And we're excited to launch this with you today and then hear back from you about how it goes. But I think, you know, there's a step between what we covered today and what you're going to do next. So looking at it on the screen, opening in the website is part 1. But now thinking about how are you going to do this? How are you going to bring this to your communities and share this information is the next step. And so I'm going to stick around and be available to any of you who want to unmute and participate in that conversation. To the rest of you, I want to offer you gratitude, and I want to encourage you to be well moving forward in your day. Thank you very much. I'm going to stop share and then see who wants to participate in the conversation.
Christina, this is Scott Ayer. I definitely want to stick around and participate.
Yeah.
Really enjoyed looking through this. I think there's so much value here. One of the things that comes up for me is the idea that within behavioral health supports for students, especially in the tier 3 space, we definitely have to include community partners and talk about what that looks like. And I see that there's language in here that touches on that, and I'm curious to know some of the thinking behind it. It's a barrier that we run up into and trying to collaborate and figure out how to mesh these two worlds together. And this is really made for the school audience. Is there something that either you've thought through or processed or thinking of creating that helps to guide the community lens, the private providers, primary care providers, even for that matter, or local mental health authorities, those folks?
Sure, Scott, thank you so much for bringing that up. And in terms of, and, you know, Sarah, Andrew, I think this is an important point to note that, you know, we often, you know, we've heard so much from folks about the interest in providing this type of tool to parents and caregivers, but this is also a really instrumental tool to adapt for our community-based partners. And I think, Scott, you land on a good point. I think that we could adapt this so that our schools are in a position to solicit, build readiness, advance capacity for community partner engagement. And that could be community-based organizations providing mental health or other resources and supports for child wellness, as well as our primary care community. And so I think a couple of things about it where we have seen overlap, especially in serving the states in the Southeast, is it would almost be a two-pronged approach, because we have a number of communities that are in incredibly rural and resource dearth environments, where putting together a list of examples of who they could reach out to their community would be almost an empty list. And so that is an area where, you know, there's ongoing growth, ongoing interest in some of our more rural communities for, you know, how do they access community-based resources when there are geographic barriers, transportation barriers, professional access to professionals is limited. And then we have other communities where, you know, whether they're suburban or urban environments, there are kind of different challenges for what that can look like. And so I think, I'm not sure. In principle, I think it works really well. And it sounds like you're coming from a community where there are opportunities to engage community-based partners. I will say some of our key best practices in that area, or that I've heard, not just in the Southeast, but across the country doing this work in school mental health, is that there are some significant cultural differences where sometimes you have schools and community partners who have long histories of deep collaboration, and building out this type of tool would look at how do we deepen, formalize, or advance those collaborations for longevity. And then you have other communities where, it's just so interesting to hear the diversity, because of the culture. There might be community providers who are so eager to get into schools, and schools who are keeping their doors closed for any variety of reasons and don't want partnership, and they want to be self-contained. And then vice versa, where you have schools who are just so eager to have community partners, and there are community partners out there, but who don't have the wherewithal or don't have the expertise to do that cross-sector work within the context of education. Does that resonate with you?
Yeah, I'm nodding along with you. I'm like, yes, you're seeing a lot of the things that we are seeing. And I think it is individuals across our state. We're here in Utah, that drive or champion the work and bring that into schools. And then in other areas, maybe not so much. You're also speaking to the diversity in our state, where we have urban areas that have a wealth of resources, or other areas not so much. But learning how to bring those systems together and to do so is a big challenge. I'll just say that.
It definitely is a big challenge. And I wanted to just underscore the point for folks, that having a wealth of resources, which, for some of you might feel like, oh, I wish that was my problem. Like, I wish I just had so many resources to draw on in my community, or had access to in my community. That does not necessarily create the opportunity that you could have. There could be communities that do have an abundance of resources, but there's not the readiness, there's not the platform for partnership between the community sector and the public education sector. And some of the barriers that come up really frequently are around, we're speaking different languages, HIPAA and FERPA concerns, sharing of information issues. And so I just want to underscore, it's complicated. No matter what boat you're in, it's complicated to create those effective engagements across sectors between our schools and school districts and our community-based partners. I will say that I feel like we're in some ways a different landscape than we've been before with some of our telehealth and telehealth for mental health. And so thinking about, how do we seize on what we have put in place due to crisis, and create sustainable and effective connection points for our students across the board, whatever type of geographic region they're in, wherever they are in the country. How are we able to build this into a long-lasting pipeline for connection between schools and student mental health support? Anybody else? Scott, anything else you want to say about that, or anybody else?
I was just going to thank you for your response. I couldn't agree more. And I appreciate, from a language standpoint, what this toolkit can offer to help bring that common language to the forefront. So thank you. Appreciate it.
Yeah. Anybody else have ideas or thoughts for how they want to take next steps with bringing this to their community?
Can I just add one thing to that, Christina? Hi, I'm Hannah. I'm coming to you guys from Wisconsin. Super excited about that, but just wanted to hop on to what the gentleman before me had said. And I mean, I'm in public health, so I'm from our local health department, and I work with our schools and our mental health clinics that are working together in collaboration for school mental health, and we're blessed with that. But one thing that I plan on doing is sharing this with the mental health clinics, just to get them to understand what the schools are doing or what the schools could be doing, and where that collaboration may exist outside of that one-on-one therapy service, that tier 3 intervention. But what else? What else is out there? What other opportunities to connect are there?
I love that, Hannah. That's such a good point. You know, as we were conceptualizing this, we were really thinking about, well, what do teachers need to know? And I don't know how many of you work with the graphic artists, but they are, there's a method to their artistry. And, you know, and so we were working with Tamar Condi, and Tamar was asking me, like, what is the purpose of this? Like, who's going to consume this and what do they need to know? Give me, you know, give me the distill it down into the one sentence answer. And so thinking about now your interpretation of, you know, well, this is actually, it's almost like, you know, a view into what's happening in schools for folks who don't know what's happening in schools, you know, and that there's this other audience out there that could look at it and say, I'm over here in my world, I'm over here in my sector doing this. And I had no idea that there was this whole system in schools, this whole framework in schools for addressing a continuum of student needs in a variety of places through a range of different practices. And so I love that idea, Hannah, as just kind of, you know, opening up a broader horizon, looking at the broader landscape of what children's mental health looks like from different angles.
Absolutely. I mean, they're speaking 2 different languages, and it's clear. And this might give them a little bit of a platform to speak the same language around mental health. Yeah.
Well, great. I'm glad you get to share that with your community. So Andrew, I want to ask you to just go ahead and drop the GIPRA link in the chat one more time for folks who didn't get a chance to click on it. We're about to wrap up here, so if there are any final comments or questions, we can take that, but I want to make sure that we leave you 5 minutes or so, if you haven't completed the survey, to do that before you carry on with your day. So in addition to asking you for the survey, my other favor is that I'm asking of you is to spread the word. So if you feel like the resource has value, if it's something that's interesting to you, we really want to get it to as many folks as possible. And so if you want to share the link to that landing page, please do. And again, we're really interested in any feedback or examples you have of how you put it to use. And then we hope to see you at our next session. I'm going to be presenting with my colleague, Carolyn Spezza, on August 11th, and that's separate from our today's series about communicating about school mental health. It's going to be on building cultures of care for our educators, for our school staff. So we hope to see you on the 11th. And I really appreciate seeing you all here today. It was great to be together, and I wish you well in your own wellness, and I wish you well in bringing this wellness to our campus communities. So thank you for the work that you're doing out there. Really deeply appreciated. Andrew, Sarah, thanks so much for your support today. Good to see both of you. We're going to go ahead and leave this page open so that folks can access the link, but I'm going to say farewell, and we can go ahead and stop the recording.